The vessels on the ventral surface of the brain. These major arteries are not accompanied by veins. The basilar artery is formed by the terminal branches of the vertebral arteries, which enter the floor of the vertebral canal through the lateral vertebral foramen of the atlas and join with the ventral spinal artery. The basilar artery courses along the midline of the ventral surface of the medulla and pons and then divides into two branches that unite with the caudal communicating arteries from the internal carotid arteries to form the caudal portion of the arterial circle of the brain. The internal carotid arteries are the other main source of blood to the arterial circle of the brain. After traversing the carotid canal in the tympanic part of the temporal bone and forming a loop at the foramen lacerum, each internal carotid artery enters the middle cranial fossa ventral to the rostral end of the petrous part of the temporal bone. It courses rostrally through the cavernous venous sinus on the lateral side of the hypophyseal fossa and hypophysis. Between the hypophysis and the optic chiasm, the internal carotid artery emerges through the duradorsal to the sinus, enters the subarachnoid space, and divides into rostral cerebral, middle cerebral, and caudal communicating arteries. The small caudal communicating arteries from each internal carotid course caudally and join the terminal branches of the basilar artery, rostrally, the two rostral cerebral arteries and anastomos, completing the arterial circle on the ventral surface of the brain. The cerebral arterial circle surrounds the hypophysis, which receives small branches from the circle as well as directly from the internal carotid artery. The rostral cerebral artery is a terminal branch of the internal carotid artery at the rostral aspect of the circle. It courses dorsally, lateral to the optic chiasm, and continues dorsally between the two frontal lobes in the longitudinal cerebral fissure. It courses dorsally over the genu of the corpus callosum. The corpus callosum comprises commissural axons that connect between the neocortices of each hemisphere. The two rostral cerebral arteries continue caudally on the dorsal surface of the corpus callosum. Their branches course dorsally to supply the gyri on the medial side of the cerebral hemisphere. Their terminal branches anastomose with those of the middle cerebral artery on the dorsomedial portions of the frontal, procruciate, postcruciate, marginal, endomarginal, and occipital gyri. Caudal terminal branches anastomose with the rostral terminal branches of the caudal cerebral artery. Internal ethmoidal and internal ophthalmic arteries branch from the initial portion of the rostral cerebral artery. The internal ethmoidal artery anastomoses with the external ethmoidal artery and leaves the cranial cavity through the cribriform plate of the ethmoid bone to supply structures in the nasal cavity. The internal ophthalmic artery anastomoses with a branch of the external ophthalmic artery on the optic nerve. This is the source of the long ciliary arteries that follow the optic nerve to the eyeball, which they supply. The middle cerebral artery arises from the arterial circle at the level of the rostral aspect of the hypophysis. It courses laterally, rostral to the piriform lobe on the ventral surface of the olfactory peduncle. It continues dorsolaterally over the cerebral hemisphere, where it branches to supply the entire lateral surface of the hemisphere. Its terminal branches anastomose with those of the rostral and caudal cerebral arteries along the dorsomedial gyri of the cerebral hemisphere. At the origin of the middle cerebral artery, the rostral choroidal artery arises and courses along the medial surface of the piriform lobe in the hippocampal sulcus to the most ventrorostral extent of the hippocampus. It follows the hippocampus and its fornix, where it provides the blood supply for the choroid plexus of the lateral ventricle. Near the origin of the middle cerebral artery, centrally directed striate branches supply the basal nuclei, rostral thalamus, and the adjacent deep white matter tracts within the cerebral hemisphere. The caudal cerebral artery arises from the caudal communicating artery at the level of the caudal aspect of the hypophysis, rostral to the oculomotor nerve. The artery courses quadradorsomedially, following the optic tract over the lateral aspect of the thalamus to the longitudinal cerebral fissure. It passes dorsal to the splenium of the corpus callosum and continues rostrally on the corpus callosum to supply the medial surface of the caudal portion of the cerebral hemisphere. Its terminal branches anastomose with those of the rostral and middle cerebral arteries on the caudal aspect of the medial and lateral sides of the hemisphere. The caudal cerebral artery also supplies the diencephalon and the rostral mesencephalon. The rostral cerebellar artery leaves the caudal communicating artery of the arterial circle caudal to the oculomotor nerve and courses dorsocaudally along the pons and the middle cerebellar peduncle to the cerebellar hemisphere. It supplies the caudal midbrain and the rostral half of the cerebellum. The basilar artery courses rostrally on the ventral surface of the caudal brainstem. Its course rostrally is often mildly serpentine. The caudal cerebellar artery is a branch of the basilar artery near the middle of the medulla. It courses dorsally to supply the caudal portion of the cerebellum. The labyrinthine artery follows the vestibulocochlear nerve through the internal acoustic meatus into the inner ear. Medullary and pontine branches penetrate the adjacent parenchyma. At the level of the rostral border of the transverse fibers of the pons, the basilar artery divides and anastomoses with the caudal communicating arteries of the internal carotid arteries.